Welcome back. 17 on set joining us this morning to talk a little bit more about cervical cancer. It was once one of the most common causes of cancer death in American women, but increased screenings have helped doctors fight this cancer. And joining us this morning, Dr. Marsha Thompson with the AIS Cancer Center to tell us a little bit more about what you need to know. So thanks so much for coming in this morning. We appreciate it.
Good morning. Thanks for having me.
So let's talk about cervical cancer. There's been, huge progression in the fact that it's no longer as deadly as it once was due to screening.
I would say that, yeah, the rates in the United States have really reduced with screening over time. Worldwide, it's still a considerable issue for women, but here in the United States with screening and with the HPV vaccine that came out a few years ago, we're seeing rates decline here.
So let's talk about the HPV vaccine. Why is that so important?
That's important for both boys and girls to get. The recommendations are from between ages 13 to 26, and really this is preventing the major strains of HPV that are responsible for cancer. And so by being able to reduce that, that is a sexually transmitted disease, and so by reducing those rates, the rates of cervical cancer, HPV is the primary cause for cervical cancer, and so with reducing that, we're able to help with that.
I mean, the fact that there's a vaccine that could prevent a type of cancer, it's truly amazing. So let's talk about screening, because that is so important. When does it start? And there's kind of some confusion about when you should be doing it.
Right.
So how do we start off? What age?
So the guidelines say at age 21 to start screening and to do a pap smear every 3 years until the age of 30, after which you can do still a pap smear every 3 years or a pap smear and an HPV test every 5 years.
Okay, so in between those 3 years, as long as you're not seeing any symptoms, then you're fine to continue on.
These screening guidelines are if they've been negative, if all your tests have been negative.
Okay.
If for any reason there have been anything concerning on your pap smear, your physician will tell you to come more frequently or to do other testing.
And are there other symptoms and signs that you should be looking for on your own, warning signs that you need to go see your doctor in between those screenings?
Not necessarily. With cervical cancer, you can't really tell. You would more see once it's really progressed and become very problematic, then you may have pain or bleeding, but at that point it's very advanced. So it's important to do the screening so it's detected early before you have any symptoms.
And are there other risk factors?
Smoking and sexual activity, those kinds of things, but really it's HPV. All of this is just to the fact that your HPV virus can affect you more if you're immunocompromised, or if you have HPV, then you're likely to get the cervical cancer.
Okay, so, just another reason we want to point out why screening is so important, because there are not a lot of things that really point to it other than getting being seen by your doctor. Okay, again, January, it's the month to talk about it. It's the month to get that screening if you haven't in a while, because January is Cervical Cancer Awareness Month. Dr. Thompson, thanks so much for coming in this morning. We really appreciate having you.
Thank you for having me.
We'll be back after this.